this high cholesterol picture. A lot of people think, well, you're eating a carnivore diet, it's full of saturated fat, and that's driving the cholesterol going up. And that does not seem to be the case. It seems to be, in this particular situation, the big driver of high cholesterol is.
Hey friends, welcome back to Meet the Truth. I'm Lauren Johnson. If you've been following along, you know that I did the carnivore diet for a solid year, and honestly, it's been one of the best decisions I've ever made for my health. I originally did it to heal from autoimmune symptoms, things like joint pains, migraines, brain fog, and severe anxiety. And within the first 30 days, I felt a lot better, so I decided to keep going. And 1 year later, I decided to get my blood work checked, just to see what's going on under the hood and whether there's anything I should adjust or pay attention to. To help me break it all down, I'm joined by someone that likely needs no introduction, Dr. Shawn Baker. He's an orthopedic surgeon, world record-holding athlete, Amazon best-selling author, and one of the leading voices in the carnivore community. He's also the founder of Revero, a company that helps people use nutrition and lifestyle to reverse chronic disease from the root. So grab a coffee, get comfy, and let's dive in. Real quick before we get started, I want to invite you to Meatstock 2026, happening May 2nd and 3rd in Gatlinburg, Tennessee. I'll be one of the speakers there this year, along with other incredible guests like Dr. Anthony Chafee, Michaela Peterson, Dr. Ken Berry, Shawn Baker, and so many more. It's going to be such a special weekend, learning from experts, sharing stories, and just connecting with people who care about real health and real food. You can grab your ticket now at meatstockconvention.com. Use code MEATMOM for $50 off your ticket. I am so excited, and I really hope I get to meet you there. Dr. Baker, thank you for being here today. I'm really excited and honestly a little bit nervous to go over these numbers with you. So when you look at my panel after a year on carnivore, what stands out first, whether that's something positive or something we should take a closer look at?
Well, I mean, of the labs we looked at, that you made available to me, I saw, what's called a CBC, or complete blood count. That was pretty much completely unremarkable. There was no lab values that would even be considered out of range. What I often see there is a relatively low white blood cell count, which, yours was not super low, but it certainly wasn't in any means high at all. And that's usually consistent with relatively low levels of inflammation. That's just one of those sort of interesting things, but you certainly were not anemic by any means, and you wouldn't expect you to be. Everything looked pretty darn normal there. And then the next other one I think I'll jump to, because it's your ferritin level. And a lot of people worry about, because you're consuming a lot of iron on a carnivore diet, particularly heme iron, which is more bioavailable, and some people worry about ferritin levels rising. And there is some association with ferritin and inflammation. There's some association with ferritin and what's called iron overload, which can affect some of your internal organs, like your liver and pancreas in particular. Your number was well within the normal range, 97, which most people would consider completely normal. I mean, at the 200 on this assay from the lab you went to was considered high, so not an issue. Now, when we go to your cholesterol panel, this is something that is not unusual at all in people on in any kind of low carb diet, whether it's carnivore, keto, or others, paleo diet, something like that. And certainly carnivore is low carb, and particularly in people as they are lean. And I've never met you before, but at least from the shoulders up, you look pretty lean to me, and I assume you're fairly lean, right? So,
Yeah.
so you have high total cholesterol, what would be classically considered high. I think what was the number here? It was 302. You've got, your LDL also would be considered high at 180. I mean, just for reference, they would like your total cholesterol under 200. Yours is obviously 302. And they would like your LDL cholesterol under 100, and yours is 180, so high. Your triglycerides, however, are extremely low, 39, like super, super, super low, and normally they like it under 150. And then your HDL, which, according to this, they wanted, 40 or higher, is 110. So this is a very classic pattern we see. High HDL, low triglycerides, yet high, LDL cholesterol. This would put you in what's called a lean mass hyperresponder, as defined by, now printed in the literature under several papers, as meeting that category of lean mass hyperresponder. And so the question then becomes, well, why is this occurring? Well, I mean, I think the physiology is reasonably well understood. We know that people, particularly as they get leaner, will see their cholesterol rise up in the setting of a low-carb diet. Why is that? It's because the liver has to provide energy to the cells. And when the liver doesn't have a lot of glycogen stored in it, it then preferentially uses fat to traffic. And when that fat is trafficking to those cells to feed them, cholesterol goes with it. And so when you're trafficking more fat in general through lipoproteins, your cholesterol just just basically has to go up as well with that, in fact. And so that's why we see it. So the question is, is it a problem? And the answer to that is we don't know for sure, but we're getting more and more data that suggests that perhaps it's not. And this would be some of the work that's being done by Matt Budoff at UCLA and the rest of the authors on those papers, Adrian Sotomoda, Tommy Wood, Nick Norwitz, and so on and so forth. And so what I would say is, and I don't know, how old are you, Lauren?
I'm 34.
You're 34. So you're considered quite young when it comes to cardiovascular risk. Imaging would be beneficial, probably more beneficial, like a calcium score would be something that would benefit you, but it's probably not going to be that helpful until you're about 40. So at this point, I would say, pay it, let's assume your other metabolic health is good, because I don't know. Assuming you're not diabetic or pre-diabetic, assuming you don't have high blood pressure, assuming you don't have some chronic inflammatory condition, assuming you don't have a big belly full of fat, which I don't think you do. I can't say for sure,
Nope.
but I don't suspect you don't. Assuming those things are good, those are the metabolic factors that we want to keep in check while we consider what to do with this cholesterol. Should we lower it? Should we change our diet to lower it? The question I always have is, why are you on the diet in the first place? And is it helping you? And if the answer is I'm on it for X, Y, and Z reason, and it's definitely helping me, then it's like, okay, well, let's continue the diet and then figure out, should we tolerate the theoretical risk of the higher cholesterol? Should we change it for some reason? Should we just watch it and see what happens? And I think those are decisions that are very individual, and it's between you and whoever's, providing you healthcare. And I will mention, because I know you wanted to mention Revero a little bit. This is what our Revero doctors do every day. We take people like you and we kind of walk through the nuance of what this is and come up with a plan on how to deal with it. Some people would choose that they don't want to tolerate that potential risk, and they decide to either change their diet or medicate or supplement to bring it down. Other people are say, hey, I'm fine with it. It's the best I felt in my whole life, perhaps, and I'm willing to take that theoretical risk and maybe get imaging to kind of verify what's going on. So those are the labs. Was there something else you wanted to discuss with your labs? I think that's what I see right here on this. So it's pretty typical. The other thing I will say, and again, this high cholesterol picture, a lot of people think, well, you're eating a carnivore diet, it's full of saturated fat, and that's driving the cholesterol going up. And that does not seem to be the case. It seems to be, in this particular situation, the big driver of high cholesterol is, leanness or BMI below, let's say, 25. I don't know what your BMI is, because you'd have to have your height and weight. We could calculate it. But assuming you're relatively lean, and this is based on a nice paper that Adrian Sotomoda put out back in 2024, January 2024, it came out. They looked at 41 randomized control trials comparing and that looked at, LDL cholesterol versus low carb diets. And the number one factor by far was how lean the person got. If you're very obese, class 2 obesity, which is BMI above 35, then when you go on a low carb diet, you're likely to see your cholesterol come down. If your BMI is like, class 1 obesity, BMI 30 to 35, or overweight 25 to 30, likely your cholesterol is not going to do too much. Again, there's obviously exceptions, but that's a general pattern based on this study. And then as you get below 25, we start to see that climb in LDL and total cholesterol. And while this isn't, you didn't test this, you can be sure that your ApoB also is high, because they all run in the same direction. They may not be 100% concordance, where one might move up more and the other might move up a little bit less, or vice versa. But every metric by which a classically trained physician, cardiologist, lipidologist would say, this is bad, you need to do something about it, you need to change your diet, you need to go on all these drugs, so on and so forth. Now, they would concede that, perhaps you're metabolically healthy and these other risk factors look really good, and those are all heart disease risk factors. And remember, heart disease occurs not, based on one number. It's a whole bunch of things that come together. Some of it's family history. The biggest according to this women's health study that was done back in 2021, I think it came out early 2021, um, by far the biggest risk factor for heart disease was diabetes, like 10 to 1, like 10 times is more powerful than something like LDL cholesterol might be. So not being diabetic, hugely important. And then beyond that, not being obese. And beyond that, it's like not having metabolic syndrome, not smoking, not having family history, not having an inflammatory condition. And then below that would be things like triglycerides, and even below that would be LDL, and APO would be kind of in the middle somewhere in there. So there you go. That's the sort of rundown on the labs you've shown.
Now, there are two others. My A1C, it's in the normal range. It was on the slightly higher side. Is that
Okay.
something to keep an eye out for? Is that something to be really cautious about?
Well, I mean, yeah. I mean, I think A1C can be helpful. It's it's kind of a general screening tool for what your blood glucose is chronically. There is some problems with it. A1C um, is basically an assumption of 90 days of red cell exposure to glucose, right? But if your red cells live 120 days instead of 90 days, they're living basically 33% longer. So they're going to be exposed to more glucose. So therefore, your A1C is going to be artificially elevated. Now, that's assuming the red cells live longer. We don't know that for sure. We would expect that healthier people have longer lived red blood cells. But there's tests you can do to kind of test for that. Some people, CGMs are now becoming ubiquitous. You don't even need a doctor. You can buy them on over the counter online now. And so sometimes a CGM can give you better data than a A1C can, if that's the issue. This is another thing that I think, because I've seen a lot of people recently talking about, with Carnivore, my blood glucose, went up a little bit, particularly my fasting blood glucose. Like I take it in the morning and it was, where it used to be like 85 and now it's 96 or 107 or 109 or something like that. And it's concerning. And I get that. But I mean, I think we have to realize that when we're talking about a fasting blood glucose, we actually have to be fully fasted. And I think what is not really understood well is that if you're eating a large amount of particularly fatty meat, it takes a long time to digest it, and so it may spend 4+ hours just in your stomach before it even gets to the small intestine, and then it might spend a long time in your maybe even 12 hours or more in your small intestines, depending on which data you look at. So that would mean that you're not even starting to fast till at least 16 hours after your last meal. And so if you eat at 6 p.m. and then you have a blood test at 8 a.m., you're still postprandial. You're still digesting your food. And so any number below 140 would be considered normal in that situation. It's like the normal range of blood glucose is 70 to 140. And if you have a post-meal number that's 110, who cares? And so I think we have to sort of realize that. I think if you're going to look at a fasting blood glucose on somebody on a carnivore diet, particularly if you're eating large meals of meat, you might have to have a longer fasting period to check that out. The other thing that's interesting, and this is something because we just don't have a lot of data on this. I remember talking with Dr. Eric Westman, who's been watching low carb people for ages, and saying that it might not be totally abnormal to see a little bit of a higher blood glucose. Now, I'm not talking 180, 200. I'm not talking those numbers. I'm saying, 110, 120 may not be that abnormal. And, the reason, and, I noted this years ago. When they first started doing metabolic studies on the quote unquote Eskimos, back in the 1920s, they found that the fasting blood glucose for a lot of them was like 120, 125, which was considered high. However, they exhibited no signs of diabetes at all. I mean, no kidney issues, no blindness, nothing that we were seeing with people that were having those numbers. So it might be that. And the other thing is, because most of our day, almost all of our blueprint for analyzing labs in basically the whole world at this point, mostly Western society, is based upon a grain carb eating population. And all of what's presumed to be normal is based on that, that rule book. And so it's like we're gonna apply the rules of playing basketball, and all of a sudden you're playing football. Well, it's a different game. There's different rules. So it may be that there's different physiology. And when we look at carnivorous animals, for instance, lions, cats, dolphins, whatever it might be, they tend to run a little bit higher blood glucose. I'm not saying we're lions and cats and dolphins, but I'm just saying we just don't have carnivorous data on human beings on what is actually healthy and normal. And this is all speculative on my part. I mean, I'll just say that. But I really like to say that, why are we concerned about high blood glucose? And certainly, really high numbers are, problematic, whereas, maybe 115, 120, something within the normal physiologic range at 70 to 140, regardless of when it's drawn, may have minimal impact, and I know there's people in the type 1 community and the Richard Bernstein folks that would say 83, it's always got to be 83 average. I'm not as convinced. I think that, there's also people on the higher carb side that said, hey, I'm metabolically healthy. I eat some blueberries. My blood glucose spikes to 120. Who cares? No big deal. Whereas there's other people that are in a ketogenic space that just want flat blood glucose all the time. It's got to be, flat and no blips. Can't be moved around anywhere. And I don't know that's right either. And I think that, so we have to, the point I was going to make is that what we're concerned about with diabetics is not the blood glucose per se. I mean, it's a variable of importance, but the concern is the damage of that situation is. And it may be the high blood glucose, it may be the insulin out of control, it might be a whole bunch of variables that are called, maybe the liver fat, whatever it might be, are leading to blindness, kidney failure, heart disease, dementia, cancer risk, all those things. That's what we're concerned about. So we can measure those metrics and say, hey, look, even though my blood glucose is running a little bit high, I don't seem to be developing those things. And again, there's a lot of people that would push back against this, but I mean, honestly, I just don't think we know. I don't think we know. I don't think we have enough data on a carnivorous human population to say what is truly normal. I think that's still to be determined. I think, you can, again, I always come back to this. How do I look? How do I feel? How do I perform? Am I happy? That's how you define health in a really useful way for most people. When we're talking about, what's my white blood cell count? What's my LDL? Most of us don't know what it is. You don't know. I guarantee you don't know what your LDL is right this second. If I take your blood, you are not going to guess it right. Maybe you got a 1 in a 300 chance of getting it right. But you don't know. It could be high right now. It could be low right now. It could be in the middle. We don't know. And do you care? Probably not. Anyway, maybe you do. I don't know. I'm just, anyway, kind of rambling here a little bit.
That's okay. That's really good to know, especially since we're all individuals and every number is going to be different. To go off based off how you feel being the number one importance, because before carnivore, I was a wreck. I had tons of autoimmune symptoms and like migraines and joint pains and everything. And carnivore, within 30 days, I was almost completely better. And so I think
this brings me to a
going
point,
based off of symptoms.
I'm glad you mentioned that, because this is a question I've had for myself, and I've meant to ask some other people what their thoughts are on this. Let's say that the relief of your autoimmune symptoms, your whatever they were, maybe you had Crohn's or I don't know what you had, but let's just say anybody in general. Somebody has an autoimmune condition, they go carnivore, they feel a lot better, and their cholesterol goes up. What if that cholesterol going up was a necessary physiological phenomenon for them to feel better? That if I artificially lowered your cholesterol now and put you on all these drugs, your symptoms came back, or they were not as good. I don't know. That I think that's a valid question, because we could take somebody who, say, had ulcerative colitis, they go carnivore, they put it in remission, they feel wonderful. We put them on a drug to lower their cholesterol, and all of a sudden they become symptomatic again. To my knowledge, that question hasn't been answered. It might be that high cholesterol is necessary for some of the healing to take place, because we do know that cholesterol participates in, obviously, maintenance of cell membranes, hormone production. It has a role in immunologic health. So who knows? It's again, there's so many unknowns here, and I think that's the interesting part. Maybe we'll figure some of these things out.
Now, my last question about my blood work was, I used to deal with a lot of kidney pain. And so I requested specifically a kidney panel to look at all of those numbers. But the bun and then the bun creatinine, I don't know if I'm saying that correctly, those were higher. Can you go over if that is normal, or is that expected on the carnivore diet?
Well, again, high protein. Let me ask, do you work out at all? Are you an exercise person?
A few times a week.
2 times a week. Okay. We know that the way we measure kidney health and kidney function in general. Just a general screen is something based on something called serum creatinine. Creatinine is a marker of protein turnover in the body, and when creatinine levels are high in the urine, that could mean that the kidneys are damaged and they are starting to leak protein, right? It doesn't necessarily mean that, but it could mean that. And because it could mean that, people often assume that a high creatinine is associated, same thing with the high BUN is associated with some dysfunction of the kidney. What it also could mean is I'm just eating a high protein diet. So it's like contextually, well, I'm eating a high protein diet. I expect my BUN to be up a little high. I expect my creatinine to be a little bit high. And then I expect my calculated something called GFR to be a little low. There are other better tests that I tell people if that's a concern, you get something called a cystatin C. That is also an estimate, but it's not dependent upon how much muscle you have, how much you work out, or how much protein you eat. It's just a straight up, test. And a lot of people would say it's a better marker. It's just most physicians are not familiar with it because the creatinine comes part of the standard basic metabolic panel that every physician orders, been ordering since 1950 or something like that. So, I mean, this is just what we've been trained to do. And it's kind of like the whole RDA, whole lab values in general. We're just used to playing the same game by the same rules. And when somebody's playing a little bit different game, we don't know how to really react to that or how to deal with that. So, I mean, yes, I mean, it could mean that your kidneys are failing and you need to get that investigated. But the most likely explanation is just a normal response to a high protein diet. And I wouldn't worry about it. So, I mean, if you wanted to, double check, go get a cystatin C, and see, or you can measure your kidney function directly, which is a bit more of a pain in the butt because a lot of times you have to collect your urine for 24 hours. And sometimes they'll give you like a substance that you would ingest like inulin or something like that. And you could directly measure it. All these other measurements are just estimates, based on, what we think is going on, but we may not be right on that.
Thank you for explaining that. Out of curiosity, what do your own lab results look like after being on carnivore for so many years? Are there things that are kind of standard for those that are in the carnivore diet?
Well, I mean, I haven't looked at my labs in a little while. It's been probably a year since I last checked. And I should probably, I don't really care that much, honestly. But for me, I mean, I generally see my cholesterol is not super high. I mean, it's higher than like what the recommended numbers are, but it's not like way up there. It's like a little bit high. That's kind of been mine for my whole life. I mean, my HDL has gotten a little better. My triglycerides tend to be pretty low, kind of similar to what you're seeing there. My, inflammatory markers are really, really low. My liver enzymes are normal. My kidney function is normal. My blood glucose is generally, runs pretty low. Although, it goes up when I exercise sometime, which is, I think that's what it's supposed to do. I mean, you think about it when you're exercising, your body thinks you're being chased by a bear, and it's like, let's dump all the resources so we can get away. And that's kind of a normal response in many ways. Um, what else is there? Testosterone numbers kind of normal-ish range. I mean, they were kind of low normal. Doesn't really, I function well. I mean, I'm not got any issues clinically with any of that stuff. So, I mean, I think that again, the numbers I really care about is how fast can I run, how high can I jump, how much weight can I lift. These are the things that, how many days do I wake up feeling good? Those are the numbers that actually matter to me as an individual. These other things are just kind of, things you can talk about that may not really change the outcome. As I, get, I'm about a year from turning 60 years of age, and I function really well, and I'm competing as a high level athlete, and to me that is a better demonstrative health than any kind of set of lab values you can pull up. I know there's people that would disagree. You get these people that are they look like physical wrecks and they've got good lab values and they brag about their testosterone number or their LDL number. And it's like, well, yeah, but you look like garbage. I mean, you literally can't do anything. I mean, who cares what your numbers are?
That's a great point. Hitting your goals with your health, like for me, just feeling better and having energy and playing with my son again, that sort of thing is priceless. And you can't really compare that to lab results. I mean, obviously, if something is terribly wrong, but just feeling better in general is a huge relief. So eating this way is definitely worth it. But if you could give me a takeaway going into year 2 on carnivore, based on what we've talked about, what would they be?
Well, I think that, regardless carnivore or not, I mean, I think that you have to realize that your health is largely in your own hands, and you haven't, as you probably noticed, someone who was sick probably went to different doctors trying to get better. They didn't really do much for it. Standard medical care. Maybe they'll throw some drugs at it. I think it's important to um, maybe partner with a medical team that gets this, that you can actually get healthier through lifestyle, nutrition, sleep, exercise, activity, stress mitigation, uh, you know, circadian biology, all those types of things. And once you start to understand that and educate yourself around that, um, the sky's the limit. You don't have to be sick. I mean, you know, a lot of people are told that you've got this chronic disease and the answer is pills for the rest of your life. For most people, that's not the truth. Unfortunately, we've kind of, and many physicians believe that wholeheartedly. They believe it with all their heart and soul, with everything they know, that they believe that the only thing we can do for these patients is just give them more pills. And the next pharmaceutical scientific breakthrough is just around the corner. Oh, wait till we have genetic engineering. We can change people's genes. That's going to be the solution. And I got to tell you, I don't think it is. I think we're just gonna have more of the same. And I think when we get to these gene shots, it's gonna be okay. What about the boot? Now you got to have the boosters, and it's just like it's a never ending kind of money grab from the pharmaceutical industry, and we have to step away from that. And as individuals, we have to empower ourselves, empower our families, and then hopefully support those people that are trying to bring this as a reality.
That's a really great way to explain it. And I think a lot of people will enjoy hearing that as well, and then feel more empowered and solidified in the decision that they've made to eat carnivore for their health and that sort of thing. But Dr. Baker, thank you so much for breaking this all down with me. It's really comforting to actually understand what a lot of these numbers mean, because for most people like myself, it's not something generally understood easily. But thank you for helping me understand them and not fear them. I really appreciate your time and your work in helping people rethink what health looks like.
Well, thank you for having me. I appreciate it. It was fun.
Wow, Dr. Baker made me feel a lot better about some of those numbers because honestly, I was concerned. But if you found this helpful, please tap the like button and hit subscribe so you don't miss more future episodes. And if you've done labs on carnivore, or if you want to, drop a comment below and let me know what your results are or what your questions are. Maybe we'll answer them in the next episode. Thanks for being here, and I'll see you next time.